Welcome to Bangkok Hospital Expert Talk with the Eye and LASIK Centre. Thank you so much for joining us today, Doctor.
Yes, good afternoon.
Could you please explain some common eye diseases?
Okay, now today as a working age, the patient will always come here to complain about the dry eye, the irritation, and the itchiness. So, we can categorize the disease. Most commonly it's three terms. First one is the dry eye. It means that, you don't have a tear enough for the work. The second one is the blepharitis. It means that you have the inflammation of the eyelids and can make your eyelid redness and have the inflammation, uncomfortable the eye. The last one is the allergy. It will make your eye itchiness, have some eye dryness. Sometimes all of the diseases come together.
Are there any advanced treatments for these diseases?
Yes, for the dry eye, tear that's not enough. We have the artificial tear for you. The next one will be like the anti-allergy to make your eye more comfortable. We can give them the steroid to make your eye calm down. And the last one, the newly one, we have the tear stimulating drug that make your body secrete the tear much more. The second one for the blepharitis is like around the eye, we have the oily gland. Sometimes it's inflamed and it's obstruction, like you have an acne. So the treatment, we start with the lip bar. We clean the eyelid, we warm the oily gland to make the gland melt, and then we squeeze it and then we clean it up. If you cannot do it by yourself at home, we have a service for the lip spa. And then the more advanced, we have the IPL, it means intense pulse light, that can make your eyelid less inflamed and let the oily gland produce more oil. The last one for the allergy, now today the environment is not good. We have PM 2.5. Sometimes you adopt the pet, you will feel itchiness, something like that. First thing you need to avoid the allergen that make your eye irritation. We have the medicine that calm down your eye. We call the anti-allergy. If it have to be progressed, we can give them the steroid and immunomodulator drug that make your immune more calm down.
Could you explain a little bit more about the IPL and how many courses they have to do or how long the treatment is?
Yeah, for the IPL, it's like you close the eye, we shine the light to your eye to make your oily gland stimulate it. So, normally we do it like 4 times, 2 weeks apart. And after that, we still have to do the lip spa between them.
And how long does it take before they can see any changes?
Yeah, normally you will see the result in the 3rd or the 4th time. So yes, we encourage to do it to complete the course.
And is there any prevention tips for these things?
Yes, for the prevention, we already know that if we do a lot of job, the best one is the protection. We have to avoid the environment that's not good, wear the sunglasses. Sometimes we have to adjust the environment like, make the air purifier, dim the light, and make the screen light is appropriate. I still advise to you to come to let us see, how your condition is for your eye. And one more thing, I want to mention about the mobile phone. Now today we use the mobile phone a lot, from the kid to adult. In the kid, if you use the mobile phone too much, you stare a lot here. Sometimes, your brain, your eye try to drop in that place. So it can induce the myopia in the future. For the adult, your eye is fully grown. But normally the adult try maybe have the presbyopia, it means the far side. So if you have to see from near, maybe you have an eye strain. If you see too much, your blink rate is go down, it can cause a dry eye. And sometimes you see the mobile phone in not a good environment. You try to see before you sleep, you dim down the light, but the screen is really bright. Sometimes it makes your eye strain, more redness, more dry eye. That can be happen.
Oh, thank you. That's very interesting. And thank you for joining us. Please join us for our next episode.